The American Dental Association has made February National Children's Dental Health Month, and this is very important as we're talking about keeping your children's mouth healthy. And Dr. Bryan Dunlap is here from Dunlap Dental to talk about ways to prevent your child from falling into a group of having problems with their teeth later in life from not taking care of them.
Right.
So this is a great subject to talk about. Thanks for joining us today.
Hey, no problem. Yeah, it's perfect for you with a 9-month-old.
That's right. That's what the first question is. When do I start bringing her to the dentist? She's 9 months old. She's got 2 little teeth here. She's so cute.
Perfect.
What should we do to take care of them, though?
One of the rules is kind of, first tooth, first year. Okay. Which, when they're about 1 year old, they're going to have some teeth, like you've noticed. A good idea, what I suggest with my patients is parents just bring them in with you with your regular cleaning.
Okay.
My staff's great. They love playing with kids if they need a little distraction. But then we just kind of take a quick look in there. You're not going to do an exam or a cleaning, obviously, on a 1-year-old or even 2-year-old. But just to look in there and just make sure everything's okay is a great idea, early on. And just make sure there's everything's all right. What you want to do is, even with a baby, a newborn, you want to take a little wet washcloth and just kind of wipe off their gums every once in a while.
Okay.
And then once they get teeth like your little toddler, just start to, maybe brush them with a little tiny brush at night. Use some non-fluoridated toothpaste right now. However, there was a report that I read last week that they're talking about with some, they're actually talking about using a tiny, tiny bit of fluoridated toothpaste.
Okay.
You typically don't want to use fluoride with little ones because you don't want them swallowing a bunch of it. It can be counterproductive, actually, and harm the teeth, believe it or not, if they ingest fluoride.
So should be doing this every day then, just barely, just brushing at the very...
Absolutely. At nighttime, bedtime, everything, just right before they put them down is a great idea. And another piece of advice, and I'm sure you don't do this, but don't ever put them to bed with a sippy cup. There's a lot of parents that I know that some parents, they won't go to bed, and it soothes them. If you got a sippy cup of milk or juice, there's so much sugar, even in milk, and they will have big problems. A lot of them will have very, very big problems, rotten front teeth, from what we call baby bottle syndrome. So water is fine. Baby bottles full of water.
And we only have about 30 seconds left. Whenever they become older in their toddler years, whenever they're children, what should we be looking out for? Well,
you're still going to be, I have a 5- and a 3-year-old, so I can speak about this. We're still brushing their teeth. They're just not quite dexterous enough or responsible enough where they're going to be brushing all their teeth. So even my 5-year-old, every single night and morning, we're still brushing their teeth and just helping them out. With my 5-year-old, we are using fluoridated toothpaste because he's old enough to spit it out now. But just really kind of, paying attention. Baby teeth don't go very far back, and they're usually pretty white. So if they have a dark, a brown or a black or a yellow spot on that won't rub off, it may be a cavity. It's a good idea to take them to the dentist and have them check it out.
Great. Dr. Bryan Dunlap, we appreciate you so much. Thank you.